I do think that will be the next step for everyone's healthcare. Surgery will be artificial intelligence assisted. It's a good thing that doctors are a little bit skeptical. Will surgeons be able to operate, to perform surgery without the robot? You never stop learning.
Hello dear viewers, I'm really pleased to welcome you at our new episode of Digital Health Interviews, and today we have a great guest. His name is Cristián Konstantinidis. Hi Cristián.
Hello Alex.
Let's start with a short intro. Please tell us a little bit about your background.
Well, I'm a physician, I'm a urology surgeon. I study medicine in Chile. I came here to specialize. I've been living here in Barcelona for the last 13 years. And I currently perform my major line of work is robotic surgery. Mm-hmm. I perform robotic surgery, and also I'm the manager of a little robotic surgery company that we have here in Barcelona. Mm-hmm. So that's a little bit.
All right. Actually, when you came here to study, to finish med school, I suppose, did you plan initially to stay here?
No.
That was like...
No, I was like thinking to come here to specialize and come back and finally stay.
I see. All right. Wanted to ask you, so you are very familiar with all the technologies and innovation in the healthcare field, but at some point when you went to med school and then you became a great doctor, and then at some point being a great doctor wasn't just enough for you. You wanted to also take part in the innovation and technology happening in this field. Why did you want to do that in general?
Well, I think it's about my personality. I think I'm always looking for new things. I pretty much like innovation. That makes me to study more, to study innovation, business. I attend an MBA. And I was looking for something that I could make my mark, you know. And I start collaborating with startups and do some consultancy. I don't know, in no time I was dealing with innovation and technology, and that path finally get me here, working with robotics and being a medical advisor of many startups.
Very interesting. I was going to ask you actually, so you are a medical advisor at many startups. First question, what are your responsibilities as an advisor? Like, what do you do?
Well, I majorly do this by freelance, mm-hmm. All right? So I do help them to understand the clinical environment. Because many times entrepreneurs had a very brilliant idea and they develop some solution to fix a problem, and that's good, that's mm-hmm. fine. However, you need to understand how the scenario works, how the system works, how the clinical attention is made, mm-hmm. and you need to understand very deeply the relationship between the clinician and the patient. Because if you can't get your solution inside that very close relationship, it doesn't gonna work. So I help startups to get in and dive a little bit that scenario.
Does that mean you have to be like not a regular user of technology, but like an advanced user?
I think so, but I don't think that's mandatory. Mm-hmm. I do think that you need to be just open to innovation, to understand that many solutions will come up from the technology side. You know, many clinicians are very, I don't know, not all, but there are some doctors that's like not very open to new mm-hmm. things. So any clinician, if it's open to understand the new technologies and how new technologies could help their patients, they will be excellent medical advisors.
That's fun because I have actually a separate question. What do you think is the percentage of doctors and clinicians that are actually willing to adopt new technologies and learn new technologies and what are not? What would be in percentage-wise?
I would say that majority of doctors will be open to do it. However, it's hard to make them to become really believers in a solution, because so many times a solution is not viable. Because when we hear about a new solution, you see so many problems in the adoption and the clinical field. That's why many doctors are skeptical in new technologies. However, step by step, this is going to change, and it's a hard thing to do, absolutely. But a percentage of these solutions will go through. And I think medical doctors will be very happy to help and embrace that technologies, but need to be meaningful for the patient and need to be reliable in the clinical scenario.
That's when you said that it's going to change. Doesn't mean it's going to change only when new doctors are going to come to the profession and the oldest are gone.
And I think it's changing, because I do think that entrepreneurs currently are understanding this situation. It's not just creating a solution. You need to implement it. You need to put it on the field and see if it works. And it's good. It's a good thing that doctors are a little bit skeptical, and because you can't test things in your patients. So if you are going to accept a new solution, you need to be very, very sure, and you need to go through all the regulations and stuff like that. And you need to, make a real impact in your patient, because if you're going to walk a path, that's a little bit, because change is hard. So if you're going to walk that path, and finally you are not making a really improvement, so why you should do it?
Right. Okay. Wanted to ask you to give us a short summary of Spanish healthcare system. How does it work right now?
Well, the Spanish healthcare system is a very good one. It's a powerful system. All the people living here and working here have a public system that's covered. Very good healthcare insurance, public insurance. But also you have a private system that coexist. But you always have your public system for you. And you can go to the private system because it's a little bit faster and can give you some advantages. However, you will always have the public system if you need it. So I think it's a good thing to combine this, but the universality of the public healthcare system for everyone, I think, is the key of success here.
From the healthcare providers, what would you say? Like for doctors, is everyone satisfied with what the healthcare system provides? Yeah, I think people, of course, if you think about salary and condition and stuff like that, I think Spain have a lot to do with that, because if you compare with the rest of the European countries, here in Spain, doctors are less paid than other countries. So there's a space for improvement there. However, it's a good system to work. You have a lot of possibilities. New ideas and innovation are embraced by the system in the big hospitals. So that will make doctors to be pleased to work there. Many doctors will love to work in the public system. And the private sector is a good sector too. For me, for example, I work mainly in the private sector, and for me, it's very meaningful. My relationship with my patients. So I think it's very satisfying both systems for doctors. Okay. Around the world, there is a huge problem in this, which is called interoperability. Basically, having access to patients' data around, city, country, or the globe, hopefully someday. Like in Israel, for example, there is no such problem. You can go to a hospital in any city and the doctor will get your information. How is the situation in Spain? All right. I think that's an issue here in Spain too, absolutely. It's getting a little bit better.
you can access the information here in Barcelona, in Catalonia, from the public system. You can, there's medical record that is shared with all the public system. That's a very good thing.
Okay.
And this is working for the last maybe 7 years or something like that. And you can see the reports, you can see the lab tests, the images that were made in a different hospital. But if it is the public system, you will access that. And the other good thing is that they come up with an application for patients that is called My Health. So patients had a record of the other episodes. If you went to emergency room, if you got surgery, if you have lab test results, etc., you have it all there. So if you go to a different system, if you go to the private sector and we don't have the public information, we don't have access to that information, but the patient had it. So they can just show it to you in their mobile phone or something like that. So I think it's a lot to do with that. I do believe that blockchain will give us a lot of benefits in this regard. And currently we are doing what we can. And we need to improve a lot, but somehow we are dealing with it.
That's good. That's good. Okay, finally, let's talk about one of the most interesting topics I wanted to discuss, the robotics in healthcare. First question, what does your company do? What kind of services does it provide?
Well, we have a couple of Da Vinci robots here in Barcelona, and we try to facilitate access to robotic surgery in the private sector because it's a very expensive surgery. And so we try to make easier for patients to access a surgeon that is performing robotic surgery. I'm a urologist, and the robotic surgery is very well known in urology, but there's a lot of advantages in other specialties, and that's not that well known. So we try to find more patients and help them to find a right surgeon to perform robotic surgery for that problem. So that's it. We work with a lot of patients, with a lot of surgeons. We work with a lot of insurance companies, and working with insurance companies is a very helpful thing because that will help patients to access finally to the robotic surgery. So that's what we do. Okay.
I have quite a few questions related to this. First one, how much did it take to learn how to use all the robotics?
Well, it depends.
For you personally?
Well, let's first say that you never stop learning.
Okay.
And your learning curve, it's never going to end. However, to be fully certified for a robotic surgery, it will depend a little bit on your background. If you are already a laparoscopic surgeon, you may find easier to go to the robotic surgery. So it depends if you are already performing minimal invasive surgery. Depending on the procedure, you will say that maybe 20 cases, 30 cases, 50 cases, and there's a lot of evidence and debate about exactly that number. And it's not the same for each surgeon either. So I will say that it's recommendable to, if you're starting with robotic surgery, to at least your first 20 cases, do it with someone with you, with more experience than you.
Okay.
Starting from that, I think for a specific procedure, let's say radical prostatectomy, you can start doing it your own.
So I found out about this fact that the Da Vinci robot, the first coronary bypass surgery was performed in 1998, and in 2000, it was approved by FDA, the robotics itself. So that means for 22 years, the robotics is already on the market, but it's still not used widely around the globe for some reason. What is the reason for that, do you think? Is it the price mostly, or what?
Well, the price is something, but I think it's quite going global currently. Of course, in the United States, it's very, very spread.
Okay.
And here in Europe, it's very spread too currently. For example, here in Barcelona, we have maybe, I don't know, maybe 25 robots. Maybe it's too much, maybe 20.
Okay.
But it's a lot of robots. And in Spain, it's more than 100. Yes, of course, it's very pricey. That's correct. However, when a surgeon touch a robotic a Da Vinci robot, for example, he will not come back. That's for sure. That's for sure. So I think it's getting big. It's getting bigger. I do think in giant steps currently.
Really?
So you have, yes, absolutely. You have in China, in Japan, in Australia, in Europe, in India. So it will be a little bit more difficult for developing countries, of course, because it's a very pricey surgery, but it will come, absolutely. And with the new robots that are coming to the market, I think the prices, I don't know, could be a little bit lower and be more accessible for everyone.
Can you imagine, I don't know, in 10, 20, 50 years that every surgery is being performed by robot?
I don't have any doubt that it will be like that.
And when do you think it's going to happen?
Hard to say. The question is, let's say 20 years if you want.
Okay.
The thing is like, will surgeons will be able to operate, to perform surgery without the robot?
I don't know.
That's a very good question, and that's a tricky question, and that's a philosophical question. It should be like that. No one knows. How many patients should have the not robotic surgery just for surgeons to don't lose that technique? Will you be that one? I don't want to be that one.
Right.
So that's a very... there are some issues about developing robotic surgery in the future because there are some more basic techniques or open techniques that if you make that maybe we will forget. And is that a good thing? It's a very interesting thing to debate. We don't have a clear answer. At least I don't have it. But it's a very interesting thing to think about. Currently, for example, if you are studying surgery or urology, for example, you are not going to see never an open radical prostatectomy that it was performed usually 15 years ago. Never. You're only going to see it if you're working in a hospital with a robot. You're only going to see robotic surgery for that. So if you go to a hospital that doesn't have a robot, what are you going to do? So that's the future. That's a very near future we need to face. But I do think that the evolution of surgical procedure and surgical techniques, it's actually like that. When I was studying, we were starting with laparoscopic surgery, and the question was, should surgeons stop making open surgery? And it was a big debate in that moment. So we are moving forward, and that debate is every single time that you have a new technique, it's about and you see the problem that we are going to forget the older technique and maybe useful. Maybe. But what can you do? But because you need to perform the last surgery, the last technique, of course. So it's a very interesting thing to talk about with in surgery committees, and there are some educational committees about this. And I do think that technology, again, will have a lot to say with this, because probably you will learn and you can practice all that surgeries in the future in the virtual reality environment. So I do think that that will be the case in order to not to lose and not to forget old techniques. You can have some virtual reality scenarios that will help you to understand, to learn that old techniques and not forget it.
That is really interesting. Did you try other robotics besides Da Vinci? Can you tell me what's like going on in the market, how competitive it is right now?
Well, it's getting very, very interesting. Robotic surgery with the Da Vinci came up 20 years ago, and it's leading the way absolutely. Currently, we have a lot of robotic platforms currently, but the most sounding here in Europe, at least, is the Medtronic platform, the Lugo, and is in the market, currently on the market here in Barcelona. I haven't tried it yet, but I do think it will be a good product, a good system. And this is the first version of it. So in the future, they will have second and third version that they will improve even more. You have the Versus, the Cambridge company. It looks very good. I haven't tried yet neither, so I can't say more. But I do think that there's a lot of technology and engineering and good professional behind all this robots. So I do think it will have a place in the market, and it will help surgeons to perform better surgeries. And that's the whole thing.
And hopefully the price is going to go down. The more competition, the more...
It should be. However, I do think that you can't have a robotic surgery platform that will be cheap.
Right. Of course.
We can improve a little bit the prices. I hope it will. However, that's a lot of work behind these platforms and a lot of regulations. And we need to have systems that are very, very, very reliable. And to secure that, you need to, work a lot and pass all the regulations. And I don't know, that's cost money. That's it.
Right. Okay. Actually, I have a free advertising on my YouTube channel right now. And I'm going to ask you, can you show on your phone, on your mobile phone, what kind of healthcare related apps do you have installed?
All right.
If there are any.
Oh my God. Let me check.
Sure. It's just interesting to see what kind of apps actually a doctor uses related to health and solutions.
All right. So I have this one, Touch Surgery.
All right.
Medtronic. Yes.
Okay.
It's a good one to... It's training application. It will show you a little bit of some procedures.
Educational, basically.
That's it.
Okay.
And actually, this application was formerly called, I think, Pulse Surgery. And they had very good content, and Medtronic buy this company.
Well, that's what usually big companies do.
Exactly. I have PubMed. PubMed is for to research some scientific articles. What else?
Any apps, which of course we can say out loud, related to your personal health? If it's not...
I have the La Meva Salud, the My Health, from the public system. I have it.
Okay.
It was very nice because you can actually, in the COVID-19 pandemic, you can download there your vaccination certificate. So it was very good, interesting. I have Dr. Alia, that is like Teladoc.
Telehealth platform?
Yeah.
Okay.
It's a good platform. And I have my lead control app, the DeviCare. DeviCare is a medical digital health medical company startup from Barcelona. They have a very nice ecosystem of solutions to the treatment of kidney stones, and they have this application that help patients to manage their disease. They give nutritional advice, and they also have a device that will measure your urine pH, and by Bluetooth they will bring the results here, and patient can give me that report in a very, very interesting reporting system. Very good application. And that's it.
That's perfect. So we'll definitely...
Oh, of course, I have my Intuitive. This is from Intuitive Surgery.
Okay.
The robotic surgery application.
All right. We'll definitely show the names of the applications. So basically, here's your free advertising for the great companies and startups out there. My question is, how do you see the future of healthcare in 10 years?
I do think that we need to embrace, as soon as we can, blockchain technology. And with that, using that technology, we will be able to start using all the potential of healthcare medical records, electronic healthcare records. And combining that with big data and artificial intelligence, I think they will give us a new level of healthcare. And about preventive, about treatment, about measuring, about recommendations. I do think that will be the next step for everyone's healthcare. And we have been dreaming about this for the last 15 years. And I do think that with blockchain technology, this comes to reality. I'm super excited about that. I do think in the future, the metaverse will have so much to say, and many things about treatment and rehab, gamification of a lot of exercise that you can do in your home. So I do think that the future will be far more digital than it is right now.
All right. And what about the surgeries in the future?
Well, I think with the robotic platforms that we have, and they will evolve, and because currently we are using the hardware, and the hardware is helping us to perform better surgeries. But in time, software is gonna help us too, and will help us to see better to the anatomy of the patient. I do think that it will even recommend to perform a surgery from a way or the other. So I do think that in the future, surgery will be artificial intelligence assisted. That will be so cool.
Totally agree. Finally, in the very end, we ask our guests to give some kind of recommendations for startup founders in digital health. And since you work with some of them, you probably see some mistakes or something that startup founders do that should probably be improved. So what would you recommend them to do in order to be successful?
I will say that keep in mind that you need to make a relevant impact in the patient's healthcare, and not little impact, relevant impact. And for doing that, you need to, besides to come up with a very good solution, of course, but besides that, you need to work with the clinicians. You need to understand the environment, and you need to work finally with the relationship of the clinician and the patient. You need to keep that very in mind, and you will probably success.
This is really good, and this is important. So thank you, Cristián. I think that was a great interview, and I really hope all your predictions of the future is going to come true.
Thanks to you, Alex, for having me here, and let's see if we can meet again.
For sure.
In the future.
Thank you. Bye-bye.